Hello everyone. In this video, I want to share a specific tactic with our frontline warriors, our doctors, nurses, and other caregivers. This is a positional defensive warfare. The target is the virus inside the hospital, so it's a well-contained battle. By observing enemy's situation, we can deploy our tactics as follows. 1. Every visitor to the hospital must wear a mask. As we know, the virus only comes from a patient's discharges out of his mouth and nose when he sneezes, coughs, and talks. So, a simple mask, any kind of a multi-layer facial mask, will instantly stop most of the virus spread. Hospitals should prepare enough mask dispensers in case someone doesn't have one or need to replace one. 2. Everyone must know how to cover his sneeze or cough. This is a reinforcement measure to further prevent virus spread. We are in a wartime, so everyone must know how to cover sneeze, just like soldiers need to know how to use rifle and grenade. 3. Ventilation must fully function, including the ones in the elevators. Make sure fan is set always on and at highest speed. Filter must be HEPA certified, capable of filtering viruses. 4. Disinfect common areas frequently. By taking these preventive measures, we can significantly reduce virus threat and eliminate airborne virus hazard. Then, it will be much easier for our caregivers to focus on treating patients. As I mentioned before, there are only two major transmission paths. 1. You breathe virus-containing droplets into your nose when a sick person close to you sneezes, coughs, or talks. 2. You poke your nose, suck your fingers with a virus-contaminated hand. Some healthcare workers worry about insufficient or inadequate PPE. Actually, once we control the environment like this, the protection gear will be much simpler. The minimum protection gear is a surgical mask, which can effectively block the virus-containing droplets from anyone. An N95 mask is only preferred in a more hostile situation where concentrated airborne virus looms, such as those unmasked Asian-populated areas. A pair of glasses can add 10 more protection against eye transmission on close contact occasions. The face shield plus surgical mask is ideal, giving out optimum eye protection and comfort. Hair cap is not essential, but it can save effort for cleaning the hair later, especially good for a long-haired lady. The coverall is not necessary, because it is mainly used for unknown deadly virus that can infect you through skin. Furthermore, it adds discomfort to the caregivers, especially considering their 8 to 10 hours stressful work. The only benefit I can think of is that it can save some effort for later cleaning of your whole body. But just add 5 minutes more hot shower, why not? So, I would recommend just a regular medical coat or gown, comfortable for working. Just make sure your first thing when getting home is to have a complete hot soapy shower to wash the exposed skins of your whole body. Sufficient protection and maximum comfort, you can make your own judgment to pick one best fitting you. Although patients are your main focus for infection prevention, you should also guard yourself from your colleagues. Don't relax your vigilance when you are in close engagement with them. The last thing of your battle is, when you go home, take off your outfit and have a complete hot soapy shower to wash away virus from all over your body. Then relax and enjoy the beautiful evening. Have a good sleep and prepare a fight for tomorrow. I'm just giving you an example of some protection tactics. I did not and could not cover all scenarios or details. In the actual battlefield, your own judgment is very important. Just remember the principle I mentioned. I might be teaching grammar to suck eggs, but the process before the virus attacks into your body is still my specialty of 30 years of engineering experience and problem-solving skills. Salute to our frontline warriors. Fight smart together. We'll prevail.